A new treatment said to reduce the recurrence of melanoma for 50% of stage 3 cancer patients is to be listed on the pharmaceutical benefit scheme. Some oncologists describe the drug as a lifesaver.
Sun protection is first and foremost for Alison Button-Sloan. 6 years ago, she was diagnosed with a high-risk melanoma on her back and a prognosis she describes as confronting.
I remember thinking, I had 32% of making 5 years. I think I cried every night for the first 6 months.
Surgery to remove the melanoma has left a 30-centimetre scar across her back. Now she says she's in a watch-and-wait holding pattern to see if the cancer will return.
It means living in limbo, worrying that it's going to come back.
But a new drug listed on the pharmaceutical benefit scheme is designed to prevent just that. Tafinlar and Mekinist is a targeted post-operative treatment for stage 3 melanoma.
These drugs target an abnormality in the melanoma cancer cells called a BRAF mutation.
Alfred Health oncologist Dr Andrew Hayden says it could save lives.
We now have a treatment that can halve their chance of the melanoma recurring.
Clinical trials showed 20% of patients had side effects, but 50% had a reduced risk of reoccurrence.
We're working towards 0 deaths from melanoma within our lifetime.
This year it's estimated there will be over 15,000 cases of melanoma detected. Over 1,700 people will die. That's 1 death from melanoma every 5 hours, making Australia the country with the highest rates of melanoma in the world. There are 11 times more cases of melanoma in Australia than the global average, and that number is growing year on year. Well, it's hoped new medical advancements will help to curb the death toll of melanoma. Doctors say prevention remains the best treatment for skin cancers.
Slip, slop, slap program in the 80s. We're only now starting to see the benefits of that.
And while he says not all melanomas are caused by UV exposure, the Sun Smart advice remains the same. Shirt, sunscreen and slap on a hat. Abby Dinham, SBS World News.